Hey, this is Jake Meyer at WAVE Physical Therapy. Today we're going to be talking about some hip openers. Okay, sometimes when we have back pain or hip pain, it's hard to know where the pain's coming from. One way to help differentiate it is making sure we have that mobility in our hips. So one thing you can do, especially when you find yourself more at a desk job or sit in the office all day and you don't really have time to exercise, you can do some simple things just in your chair while you're still working or take a quick break. So hip openers are one thing you can do. So one thing you can do, depending on your flexibility and mobility, is just getting your ankle up toward your knee. Sometimes this is going to be enough. Just sitting there like this and try and get that knee down a little bit. I classically have pretty tight hips, and this is about enough for me. If you feel like you don't get much out of this, you can simply just add a little bit of pressure down at your knee to help get a little more rotation through your hip. Should feel that hip maybe stretching the front of the hip, maybe into the back. Okay, hold it for a couple seconds and let it go. Maybe looking for like a total of 1.5 to 2 minutes of stretch, holding anywhere between 10 to 30 seconds. As that feels better, a third progression you could do would be keeping the pressure there and then leaning forward at your hips. And that you're going to feel a lot more into the back of your glute, getting a good stretch in there. And try to keep your spine nice and straight as you're doing that, especially if you're having some back or hip pain. And then the fourth variation, you could just kind of pull that across your body to get a little bit more of a stretch in there. If you get like a deep groin pain or stretch, don't force this one, but just kind of focus on that opening motion. Hope that you find that helpful. Give them a try, like or comment below what was helpful and how it goes, and follow us for more for weekly tips and advice.